Hello, I'm Maura Carley, founder and president of Healthcare Navigation, and today I wanted to talk to you about the problem of dealing with staffing shortages in the United States, particularly in inpatient settings. So, as you know, we generally talk about coverage issues, but at times we also look into other healthcare issues that are important to all of us. And this is one. Many of us live healthy lives for many, many years, but it's almost inevitable that you are going to have to deal with being an inpatient or having a loved one who's an inpatient. And there is an article that caught my eye that I'm going to tell you about in a minute. But having spent my entire career in healthcare, I'm very aware of the dilemma of staffing shortages, particularly nursing staffing shortages. You know, they are a chronic problem made worse by the pandemic. One fear I have is that the states that have implemented mandatory staffing ratios may actually think that's a solution to this dilemma. People in hospitals and nursing homes aren't sitting around thinking of how they can operate with inadequate staffing levels. You know, just the opposite. But let's face it, let's just take nursing as an example. It's a difficult, challenging job made dramatically clear by the pandemic. And it's largely a field still of women who have many other opportunities now. So this is a challenge. But the article that caught my eye was in the Wall Street Journal on August 1st. And the title of it is Countries Raid Each Other's Health Systems in Global Battle for Nurses. And everybody should read this article. We'll provide a link. It was fascinating. But, you know, through my research, I found another article in Forbes that suggests 16% of nurses in the U.S. are from other countries. And the Wall Street Journal article features the problems of wealthier countries relying on staff from poorer countries with sometimes pitiful staffing ratios themselves, and what these countries and what the World Health Organization are doing to prevent it. And, you know, that's one reason people should read this article. The World Health Organization, unbeknownst to me, earlier this year published a list of 55 countries, 37 of them in Africa, asking member nations not to recruit healthcare workers from those countries. That doesn't prevent people from other countries trying to become employed in wealthier countries, but the whole process for approving people from other countries has been slowed in the U.S. So anyway, people need to understand this is a problem, and that when my loved one is an inpatient, the facility, be it a hospital or nursing home, may be struggling to provide adequate staffing levels. And this will likely be a chronic problem. So what can I do? And that is the topic of our next video, which accompanies this one, because there are many things you can do. I mean, not all of us can afford to have a private duty nurse or an aide that we retain, but there are very common sense measures you can take, understanding that it's more difficult in an emergency situation. But I urge everyone to watch that next video that I'll be taping in a few minutes. Thank you for watching. Read that article, fascinating. And so we have to have some sympathy for these poorer countries too. What they're dealing with is extraordinary. So take care. Thanks for listening, and I look forward to seeing you soon. Bye-bye.